The WCA home has private rooms for seniors who need assisted living. We are a nonprofit home founded 125 years ago for women, now seeking approval for men. Our mission has always been top-notch assisted living. Westfield Memorial Hospital provides high-quality health care to residents of Western New York, offering patients the most sophisticated medical advancements while keeping the ease and familiarity of a community hospital. Support for Chautauqua Sunrise has been provided by WRFA 107.9 FM, Jamestown's public radio station, streaming online 24/7 at WRFALP.com. Low power to the people. Funding is provided by a grant from New York State Senator Catherine M. Young, representing Western New York's 57th District with a local office in Olean. Chautauqua Sunrise is made possible by a grant from Fredonia Place, a continuing care retirement community providing dignity in a modern luxury environment. Meter's Restaurant, a family tradition for over 50 years in downtown Ripley, is a proud supporter of Chautauqua Sunrise. Meter's provides all-day dining, banquet services, and custom catering, specializing in pie. From the Access Chautauqua Studios in Mayville, it's Chautauqua Sunrise. Chautauqua Sunrise is hosted by Doc Hamels and supported by the award-winning volunteers at Access Chautauqua. We are here to share local news, colorful interviews, and events of interest to everyone. Chautauqua Sunrise is broadcast live Saturday mornings each week from 9 to 10 a.m. Send events via email or call us live. Check us out on YouTube and Facebook. And now, from the Access Chautauqua Studios, it's Chautauqua Sunrise.
Well, good morning, and what a beautiful day it's going to be. I hope we're finally out of the sub-zero temperatures. Wowzer, what a week, huh? Schools closed, thruway closed, wind, snow. But we don't have hurricanes, fire ants, or mudslides, right? That's what we keep telling ourselves as we're putting on 15 layers of clothes in -8 degrees. But you know, I was reminding folks, it was just a typical winter when you think about it. 5 years ago or whatever it was. Justin, what was it? It was like 30 below zero, wasn't it? Remember those? Holy moly, that was unbelievable. So we got through it, and here we are, and the temperatures are going to moderate, and everybody by now already knows it's going to be like in the upper 30s today and 40s tomorrow and 50 on Monday. I don't know if this is the January thaw late or if it's an early spring. I don't know what the deal is. So we're just going to have to keep track of that. But we made it through another winter freeze, and we probably will have another one before we know it. But we're on the flip side of winter, and we're looking forward to just nicer weather, huh? And let's see. I want to first of all say good morning to all you that are watching this morning. And if you can only watch part of this show today, always remember you can go to channel 1301, as you all know. But for my listeners, they don't always know that. And you can catch us on YouTube forever and ever. And but if you have a question, a comment, something you want to announce for your club or organization, give us a call at 753-5225. And to my listeners in Jamestown, good afternoon. It's Tuesday, 1 o'clock on WRFA 107.9. Low power to the people. So glad you could join us. And we've got a terrific show in store for you. And these topics to me are always multi-generational. And this one is definitely a multi-generational show, meaning that the things we're going to talk about, I'm going to talk about folks that are older, people that are like in between the sandwich generation, and younger folks as well, because it's going to cover everybody because, well, you'll see why. All right. I got some interesting statistics today. They tell me that today is show 240. Pretty cool. I'm chasing the Wheel of Fortune, though. They just clocked 6,000th show. Holy mackerel. Can you imagine it turning those letters 6,000 times? Yeah, so they're still going strong. All right. Let's see, what does this say? Okay, I have a bunch of announcements that I want to share with you. And as always, please don't hesitate to send us your information, your announcements, your spaghetti dinners, pancake breakfasts, whatever. We're here for you, and it's all free of charge. Happy to do it. And a lot of times they'll post it on the community bulletin board that kind of rotates when we're not on the air. So let's start out in Jamestown. On February 11th, this will be our first slide of the day, Rolling Hills Radio hosts Christine Lavin and Jen Siggett, or Siget, I don't know how to say it, at Shawbucks in downtown Jamestown, New York. Okay, the first person is Christine Lavin, is a singer-songwriter, guitarist, recording artist who has been based in New York City since 1984. She has released her 23rd solo album, I gotta say this slowly, Spaghettification, which was number 5 for the month of September, according to the International Folk DJ chart. Dave Van Ronk himself suggested Christine go to New York City and make music her career. She did just that and has become one of the most beloved, witty, and endearing performers in Americana. Now, Americana is an interesting term. Bill Ward, a local musician, kind of taught me that word, and it kind of encompasses what a lot of us do, Americana music, because it's a little bit of country, it's a little bit of blues, it's a little bit of folk, it could be country rock, it could be a little bit of everything, but it's our kind of music. And so a lot of our performers, like myself and others in the area, we play Americana. It's our own style. It's kind of hard to pin down. Along with Christine, singer-songwriter and multi-instrumentalist Jen Siggett has 3 solo albums under her belt, with her latest release, So Long, Pollyanna, named as Album of the Year by both John Bomarito, he's on the radio over in Ann Arbor, and the Progressive Torch and Twang, which is in Lansing, Michigan. So Long, Pollyanna, I'm sorry, was also nominated for 2 Jamie Awards out of Grand Rapids, Michigan, including Best Song for Sugar High, which later won Best Country Song at the Garden State Film Festival in 2014 for its use in the independent film Buffalo. Now, besides touring and playing shows, Jen also hosts the weekly radio show Electicana. Justin, did you write this?
No.
Holy moly. Electicana is down in Lansing, Michigan. I think they're thawing out yet. I think they were in the sub-zero weather, like 60 below. Has been commanding the airways for 6 years. Ken Hardley, many of you know him from our show here, he's been our guest, says the following: Christine Lavin is one of the most deft, prolific, touching, insightful, and hilarious performers to grace the Rolling Hills stage. She ensures a lively and altogether fun evening. As for Jen, having just released a new album and listening to it reveals that her songwriting continues to grow in depth and creativity. I'm a little biased because she's a friend of mine. This is her, Ken speaking, but you can believe me, I'm happy she's making the trip from Detroit. She's tremendously popular in Michigan in the Midwest. Thankfully, she decided to branch out to the east. Okay, so it's at Shawbucks. It's going to be on February 11th, and it's going to start at, the doors open at 5:30. They have their happy rolling hour till 6:15, up to which time you can get beverages and some food. Show starts at 6:30. The bar does reopen at around, somewhere for 10 minutes, midpoint, and tickets are only $15. So if you want a nice, fun evening of music, give them a call at 294-0416. Again, 294-0416, and get over there and have some fun. February 11th, Rolling Hills Radio. Okay. It's that time of year, guys, here in Mayville, the President's Day Weekend Winter Festival. They're looking for volunteers for the annual President's Day Weekend Festival. That's February 15th through the 17th, right down the road at Lakeside Park, hosted by the Mayville Chautauqua Community Chamber of Commerce. There are volunteer positions available to help staff do the following: parking, booths, game, and a whole lot more. A 2-hour time commitment is all it takes. Oh, that wasn't for me. Oh, I'm sorry. Oh,
I love talk, but
I love you too. We've been invaded. A Zook just came in. You never know who's going to show up here at the studio. Where was I? A 2-hour time commitment is all it takes, and most of these volunteers will be in a heated tent. May I remind the word heated tent is really important, or building. For more information, give Debbie Marcella a call at 753-3113. This is really good, especially if you're in high school. A lot of kids need volunteer hours. Various service organizations have worked there. Over the years, our Rotary Club did the parking. We sort of retired from that job, but I know that they need help, and it's a lot of fun to do it. Also, you can sign up for their scavenger hunt, or, hey, is Randy going to do the polar plunge this year?
probably not.
Probably not. Okay, I think the doctor probably doesn't deem his heart strong enough. Hit that cold water. But I know George Borrello does those kinds of things, so hopefully we'll see pictures of George jumping in.
Or my dad's just a wimp.
I wouldn't say it.
Probably a wimp.
I just got it from Randy. He says, are you kidding? He's not doing it. Okay, let's go on to slide 16. Lakeshore Center for the Arts presents The Very Thought of You, directed by my buddy Rick Matthews, February 16th at 7:30 p.m. That's over at the Lakeshore Center for the Arts Theater, which is part of the Presbyterian Church. You enter from the street side, just opposite the library in Westfield. Tickets are... let's see, hang on, $10. And if you're interested for pre-sale, give them a call at 224-2133. And the address there is 49 South Portage Street, right in downtown Westfield. The very thought of you. I got to tell you guys, if you haven't been to that theater, it is personal, it's friendly, it's warm, and there's no bad seats there because it's a very small theater, and it's great entertainment. I've been very fortunate to be part of various productions there, and it's a great time. All right, we had Randy Anderson here last week, and we still are pulling things off the ceiling because he electrifies the studio when he comes here. But he wants me to share the following from their chairman of the Sports Hall of Fame. Chip Johnson, chairman of the 38th Annual Chautauqua Sports Hall of Fame Induction Banquet, has announced the locations where tickets may be purchased for the February 18th event. You can go to Jamestown Cycle Shop down on Harrison Street in Jamestown, Matt's News on 3rd Street in Dunkirk, and the Chautauqua Sports Hall of Fame at 15 West 3rd Street in Jamestown, where you can get your ticket. Tickets are $50, and you can give Johnson a call at 485-6991. And I'm not going to give the whole list of inductees because we talked about them last week, but if you want to go back to my show, it's on Facebook, and we have pictures, and Randy gave us all the background of all of the winners. And if you haven't been at the Sports Hall of Fame, way cool place to go. That's all I can tell you. It's just way cool because they have so much stuff about Chautauqua County in the sports and all the great athletes, coaches, even sports announcers are in there and so forth. Check it out. Okay, Chamber of Commerce seeks award nominations. I'll just read part of this because you may have somebody that you're interested in nominating. Each year, the Chautauqua County Chamber of Commerce and its 6 community chambers recognizes local businesses, organizations, and individuals for exemplary service. The Chautauqua County Chamber of Commerce presents the Economic Development Award and the Person of the Year Award, and the Chamber Board of Directors has now opened up nominations for this year's awards. Okay, so if you know somebody that falls in these various categories, give them a call at 366-6200 or 484-1101. They've been doing this for over 30 years. The Board of Directors review all applications, sometimes I get tongue-tied there, and makes its selections for this year later in the spring, and the awards are presented during their annual Chamber of Commerce banquet in October, but you gotta make your recommendations and nominations now. Each of the 6 community chambers selects a community service award recipient for the year from their area, and the awards recognize individuals or organizations that have actively contributed to their communities, past or present, and you can make those suggestions as well, and those will be awarded in July. Okay, also, the Jamestown Community Chamber of Commerce will hold its Salute to the Finest program on March 4th at Shawbucks. They're a popular place this year. Over on West 2nd Street in Jamestown, awards will be presented as follows. Business of the Year, Lakeshore Paving. New Business of the Year, Chautauqua Harbor Hotel. Manufacturer of the Year, Cummins Incorporated. Pride of Jamestown, the Reg Lene Center for the Arts. Retailer of the Year, Wegmans. Service to Humanity, UCAN Ministry. And Young Business Persons of the Year, Joe and Olivia Town. This delightful annual recognition event helps to honor some of the people and businesses that make the Jamestown area special. It's sponsored by Elegant Edibles Catering, and you can register online to go to that at 484-1101, or go, I said you can do it online. That was call in. You can go to chautauquachamber.org. So register online at Chautauqua Chamber, all one word, .org, or call 484-1101. Okay, we also have a relatively new announcement, and this is coming in from the north. Flapjack fundraiser. There it is. Applebee's in northern Chautauqua County. The Northern Chautauqua Community Foundation presents Short Stacks for a Tall Cause. Short Stacks for a Tall Cause. Flapjack fundraiser and basket raffle. Proceeds benefit local schools through the Service Learning Mini Grant Program. It's going to be held on March 23rd, 2019, 8 a.m. to 10 a.m. at Applebee's on Vineyard Drive in Dunkirk. Tickets are only $6, and then they have basket raffles, $10 for 25 tickets. Whew. Okay, for tickets, you can go to the Northern Chautauqua Community Foundation at 212 Lakeshore Drive in West in Dunkirk, or give them a call at 366-4892. All right, and last announcement, and according to the crew here, the most important announcement is the 2019 Girl Scout cookie season is in full swing, and it's going to end in March 31st. And here we go. Here's the selections one more time. Get your mouth watering. Okay, caramel chocolate chip, which joins the Thin Mints, Caramel Delights, shortbread varieties. Caramel chocolate chip features here we go, Justin, rich caramel semi-sweet chocolate chips and a hint of sea salt and a chewy gluten-free cookie. How can you resist? We've already got our supply for the year. So when those little girls come knocking at your door, make sure you pick up at least a couple boxes.
For the year or for the week?
Whatever it takes. Okay, I just got in on my earpiece. We have breaking news, and you all been waiting on this, and you heard it maybe second here. I don't know. Maybe you don't even know this. But let's pop up his picture, Jeff. There he is.
Oh, God.
There he is, Punxsutawney Phil. And here it is, breaking news. Punxsutawney Phil. Did you see his shadow? What do you think?
I don't know.
You don't know? What do you think?
Nope.
He did not see his shadow. Good man, Phil. And that means spring is around the corner, and we sure could use good news today. So, folks, Groundhog saw his shadow. Spring is around the corner. We're going to take a break, and we'll be right back. Stay tuned.
Oh!
Checking your fantasy league?
Nah, just my 401k statement.
Nice. Where'd you find the money for that?
I just been saving a little every month.
I can't seem to save anything.
Well, what about all this? What about the money you're spending?
What money? It's gone before I can get my hands on it.
I got a pizza for a Todd.
Hey, can somebody spot me?
When it comes to financial stability, don't get left behind.
It's 547.
Get tools and tips for saving at feedthepig.org.
All right, we're back. I'm Doc Hamels. You're watching Chautauqua Sunrise and listening to us as well. Good morning and good afternoon, and welcome back. My guest today hails from the Office for the Aging. I invited Mary Ann Spanos to be here. She was busy, and so she went and got a very important person to come in today. I want to introduce and welcome Dana Corwin, who's the Director of Aging Health Services. Did I get that right?
You did. Good morning.
Good morning. So you came all the way from Mayville.
A whole block and a half.
A block and a half.
I have the best commute in the world.
You are great on that. So, Dana, you are with the Office for the Aging, and you were telling me you've been there quite a while.
I've been there 11 years, this actual last January,
Okay.
last month.
So you just had a
It's flown by.
anniversary. Oh my gosh, yes. Time is a really incredible thing. So welcome to the show.
Thank
and
you.
Mary Ann and I basically talk about what's going on in the big picture and in the local picture and then right here in Chautauqua County. But before we do that, tell us a little bit about Dana Corwin that you want to share. And that's up to you. I'm not going to ask any probing questions here. Just remember, this is recorded for posterity.
There you go. There you go.
And your children may be watching this later on.
Well, two things jump out first. I just want to give a shout out to my family.
Okay, go for it.
I was just telling Doc that my husband actually proposed to me on Groundhog Day. So I don't think he's up quite yet, but maybe he'll be able to see this. So we'll be married 27 years.
Well, good for you.
In another month.
All right.
So kind of an interesting thing. And then one of our staff members out of our Dunkirk office, Kate Finch, this is one of her very favorite holidays. So happy Groundhog Day, Kate Finch.
What makes it so
she has
does she celebrate or?
I believe she does. She has in the past. So she's
What do you do for Groundhog's Day?
There's usually a cake involved.
Okay.
So some kind of cake or cookies.
In most offices, food is usually a high priority, I've noticed.
Definitely a go-to when you have food. But
I worked at one place and they used to call it the food altar.
Oh, yeah.
Because people just brought food and all kinds of stuff.
it does attract people, and it does help with a longer meeting, so that's kind of nice. That's kind of nice. But
So
as I was telling you
Yeah.
before, we absolutely love Chautauqua County. We actually came here on vacation. I guess it's been almost 14 years now. My husband and I, when our kids were little, we had a trailer for camping, and we always went to KOAs. So I got out a big book one time, the KOA book, and I said, I've never seen the Great Lakes.
Oh my
Let me
gosh.
go see the Great Lake Erie. So I found KOA, which is right down there in Westfield,
Right.
and then we found another KOA somewhere in the middle of the state. And we decided to come here on vacation.
That's great.
Our plans got waylaid that year, so we had to rebook for the following year. And when we came back, we stayed in Westfield. We actually had some friends, believe it or not, from our local town, which was Westminster, Maryland. And then we came to Westfield, New York,
Yeah,
which
but
got
that's the
really
name.
difficult from time to time. I would get them mixed up all the time. But we just learned about Chautauqua, and we met the people in Westfield, and just absolutely fell in love with the area.
You know, my wife and I and our Rotary Club, all of us together, we hosted some folks from Australia. They were on the show, parts of it last year. And I remember they just stood and looked at the Lake Erie. It was overwhelming to see how much fresh water we had.
Absolutely.
And they're dying for water in like Australia and other places because it's so arid. And so we don't appreciate what we have at times, do we?
Well, I think that Chautauqua County does a really good job of promoting all there is to do. I mean, look at your list. There's your list. If you look in the papers, there's lists of all kinds of things to do. You can go online. I get emails to me, what's happening in Mayville, New York
Right.
this week.
Right.
So there's always lots to do, but you're right about the water. The water is just amazing, and I'm very interested to hear and learn about the lakes and the challenges and the difficulties that happen and the beauty. This was the first year friends of ours from Ripley took us out on their boat on the lake.
What
It
was
was the
that?
first time Terry and Candy, and I'm going to space on their last name, sorry,
That's okay, Jerry Katie. All right.
from Ripley.
Okay.
Took us out on their boat, and it was wonderful to go across to Bemis and dock there for a little bit, and then go under the bridge, and then come back around.
Going on the bridge is really cool.
Oh, it's
isn't it?
amazing.
Yeah,
It's
I always
amazing.
yell. See, there's an echo.
Does it work?
No.
Krebs, there it goes. Terry and Candy Krebs.
There you go.
There you go. So we've just enjoyed getting to know it. Our kids have been out tubing and boating, but this is the first year, the working parents got a chance to take a break and get out on the lake.
My granddaughter and I, since she was very little, Kyla, actually she's been on the show years ago.
How old is she now?
She's 13.
Okay.
And almost every year for her birthday, she and I go down to Jack's Barcelona Drive-In, and we have lunch there.
Do you get a purple cow?
No, she gets this double-decker cheeseburger thingy. But anyways, she used to say to me, "That's our beach." Somehow
yeah.
she owns Barcelona Beach. She just absolutely adores it, and we just spent hours and hours down there, and it's just fantastic. All right,
It is a beautiful spot. We like that place.
So you came in
too.
from Maryland, but what was your occupation all this time?
I've been a registered nurse for, since 1991, and I have worked in the area of geriatrics or older adults for 26 of those years.
Was that a specialty that you studied?
It is. I'm certified as with the American Nurses Credentialing Center as a specialist in gerontology. I've worked in nursing homes. I've worked for large pharmaceutical companies as a nurse consultant. I've been in and out of hospitals. And then the last several years when I was raising my kids, I mostly concentrated on working in nursing homes. So when I moved here, one of the things that I thought was just absolutely amazing was I got a chance to call into Westfield Hospital because we were moving here and I needed a job. And when they told me about the size of the hospital, I was just overwhelmed. It was so cool, for lack of a better word. It's an amazing little spot, and they do such great work there. When we lived in Westfield, they were our point source of assistance. When anybody was sick in the middle of the night, they do a great job. The people are friendly, so I was just really enthralled to find this little hospital. And then to learn about what had been happening in the healthcare situation with the Burger Commission and other things that had happened. So I settled in and worked for the local nursing home in Westfield for a little while.
Absolutely.
And then a friend of mine from work told me about a position with the Office for the Aging. And I thought, this is perfect. So I got a chance to meet with Marianne all those years ago, and I was lucky enough to be hired. And my job there has kind of morphed. I started out working with what's called the ISEP home care program, which is expanded in-home services for the elderly. And basically as a nurse, I would go and see people that called into the Aging and Disability Resource Center, otherwise known as New York Connects, written tiny print there, that said they needed help in one way or another. So we work to put services in place that help people stay in the community for as long as possible.
We know
There
New
you
York
go.
Connects.
Oh, thank you. New
We're
York
a proud
Connects.
sponsor of New York Connects Hotline here.
Wonderful. Yeah, and we've got 3 great operators in New York Connects. So if you get a chance and you don't know exactly what you're needing, New York Connects is New York State's Aging and Disability Resource Center. So there is an Aging and Disability Resource Center in any state you go to. But in New York State, we're all called New York Connects. So we have Chautauqua, New York Connects, and then there's Cattaraugus, New York Connects, in Erie County. So when you call into New York Connects, sometimes you know what you want. You might need some information, and we can give that to you almost immediately. But sometimes you aren't quite sure what you need, but you need something.
All right, so let's make an example. So let's say I call you up and say, I said this was going to be a multi-generational show. So I'm going to say my grandfather, I'm going to take it from the young kid point of view. My grandfather is having trouble walking and I don't know what to do. And he needs to go to his doctor appointments. How can I help him?
Well, we would first say, well, when did it start and what kind of things are going on? Does he use any adaptive equipment? And we might find out if you've had a conversation with his primary care physician, because that's an important place to start. That your medical team, your primary care physician, or your nurse practitioner, your PA, they're the head of your medical services.
Right, your team.
And it's very important that you communicate with them regularly. They cannot read your mind, although many people think they can. So we would encourage you to have you reached out to talk to them. And if so, what was the outcome for that? Many people don't know that they can, call their physician and say, I'm having, more trouble getting up and out of a chair, or I'm having some weakness and I can't do this.
So it's almost advocating for yourself.
Oh, absolutely, absolutely. So having that conversation with the physician might produce a visit and an evaluation, and out of that evaluation might come a prescription to go have physical therapy.
Wow. True or false? My history and experience with older folks is I don't want to bother the doctor. I'm not sick. It's no big deal. I don't want to go there because they're going to put me in the hospital. I hear all of these things, right? And they're just not true as a rule.
No, not at all. Your providers, your medical team, your nurses, your doctors, whatever the pot is that you're into there, they're really committed to seeing you be independent.
Right.
Nobody is saying, if you come to see me and I see you have this deficit, I'm going to send you to the nursing home, or I'm going to make you go do this, or I'm going to make you go do this. What we forget is that we as individuals have the ability to make decisions for ourselves, even if people think we're somewhat compromised.
Right.
And that's one of the things we're working on right now, if we can talk about that for a minute. Governor Cuomo has done a good job about putting New York State right in line to be an age-friendly state. We've been working on a lot of different things at a state level that Marianne is very involved with. But at a local level here, we're just starting actually on the 30th of January. We had our first kickoff meeting And if you read the papers, our articles are in the paper
Absolutely.
coming up.
In large print.
They got to be in large print or we get out our readers. But we are going to be working towards a dementia-friendly community.
Dementia.
Dementia-friendly community. Now, dementia is a term used to describe a whole lot of different behaviors and activities and symptoms. And then out of that are a whole lot of other things that come: Alzheimer's, Lewy body disease, frontotemporal lobe disease. But what we're trying to do with New York Connects and with the Office for the Aging is really look at how can we support people in community. Mm-hmm. And that means people of all abilities and disabilities. So just because someone may have some difficulty doing some what we call activities of daily living, paying the bills or doing the dishes, we can provide services in there that kind of support them and buoy them along so that they can be successful in community. Most people want to stay in the community, be around their friends and their families, and be involved with things that bring them pleasure and joy and make them feel purposeful. You probably feel that way. I know I do too. Mm-hmm. So why would it be different for anybody else?
Absolutely.
So we work very hard for that. So we're putting together a subcommittee of our Long-Term Care Council. Let me back up by saying the Long-Term Care Council is part of New York Connects. It's an overseeing body that looks at the information that comes into New York Connects, and they're tasked with finding gaps in service and large areas of requests, and then making some work to advocate for those things. We can't change laws and policies, but we can support them and we can say how important these things are to people in the community. So one of those areas is supporting people in the community with dementia, not only the person but the caregivers. And there's tons of facts and figures about the impact financially to a community for keeping people where they are, paying their taxes, using services, and the quality of life. That is really the most important thing, is the quality of life. So we're just starting work on putting together a subcommittee that will be working towards hopefully putting Chautauqua County as one of the first counties to be declared dementia-friendly.
Wow.
What does that mean?
This is brand new, right?
It is brand new. January 30th was our first meeting.
Wow.
So there's been a press announcement in the papers. The county executive has put something out saying how important it is. And our work is really to figure out from people and caregivers living in the community what it would take to make them successful in community. And getting rid of some of the stigma is really, really important.
Let me flip, you just hinted a little bit at it. I'm going to ask you a question. I'm going to flip it. What is a non-friendly dementia county?
A non-dementia friendly county would be maybe businesses and an environment that doesn't look to the needs of the people. So
lock them up, put them away. No, seriously,
well,
right?
a stigma, yeah. You can't do this, so you must need to be there. Mm-hmm. But looking at a built environment, looking at housing, looking at the way an environment is set up in a store, mm-hmm. Making it apparent and giving more information to the layperson that works at the diner or at the bank or at the dry cleaners, or the police officer or the EMT that may notice that there's, the person is struggling in different ways, maybe making decisions or making poor decisions, and then helping them to realize what resources are available, where to refer to, but then taking the time to help meet the person where they are.
This sounds very much similar and parallels my career working with children with disabilities and with the American Disabilities Act and so forth, mm-hmm. where now you have more, what's what I want to say, accessible facilities. People
Absolutely.
are much, much more open to folks that have mental disabilities or physical disabilities. It's not a stigma. They don't
Exactly.
cringe as a rule. And these folks are part of society as they should be.
Yeah.
So it sounds to me it's the same thing.
Very similar. It's enabling someone to live in community as independent as possible, mm-hmm. and providing them the resources. Whatever difficulty they have in living their life, we can put in some supports to help them.
Dana, if I'm not mistaken, and again I'm drawing parallels and comparisons here between the two populations, dementia and folks with disabilities and so forth. 100 years ago, 200 years ago, whatever, going way back, these folks were not seen. They were locked away. They were put in institutions or whatever. So they'll fast forward the tape, and now the main thrust is independent as much as possible, still living at home or being as productive a citizen as they possibly can, as opposed to being locked away.
Absolutely. It's an empowering people to have freedom and choice. Just because someone has a cognitive impairment or a physical ailment or a mental challenge that they live with, we're all needing to rally around and recognize that that's who that person is. And if we can meet them with it where they are, they can have a good quality of life, and the community can work together to make that be successful.
Sure. That's terrific. While we were talking, I got a question that came through. We get all different ways. So let me read the question. It says, okay, what about people who are scared? Cancer is obviously very predominant and prevalent in our society. What if they just don't want to go find out something bad?
Well, that is true. I can certainly appreciate, kind of, what's the term, putting your head in the sand and just saying, la, la, la. Yeah. There is power in knowledge, understanding. My mother used to say, you don't have anything to worry about unless you figure it out, and then you've got something to worry about. So ignorance is good there. But I think just having an honest conversation with yourself and the people that you love about what you can handle and what you can't handle. Sometimes people, when they're afraid that they're going to get bad news, not only is it difficult for them to take that in, but maybe they feel that the people around them wouldn't be supportive. Mm-hmm. So, and that could apply to a million different things. So understanding kind of how you are and what you may need. If I'm going to get bad news, I may really need to have this person with me, or I may need to know X, Y, and Z before I get that bad news. If you're a planner, you find out what's available, and then you face the situation, knowing that you've already got some information behind you to work with.
So if you're a senior and you suspect something like this, by waiting only makes things worse. So if I would think as soon as you get an inkling, can they call your office?
They can call New York Connects.
So
absolutely.
So they could call with a health issue, and then you refer them out, or
we have a lot of people that call just to find out exactly what's available. They might need something right now, but they said, I'm doing well, but what's available if I need help with this?
That's proactive.
Or what's the process? We do a lot of presentations around the county, and we talk about, understanding what's available in your community now can save you a lot of chaos later on, a lot of chaos. And that's where things really kind of hit the fan. So calling New York Connects and finding out, this is what I may need at some point. How would I get there? So doing some of that pre-planning. We also talk to people about, just planning for life, putting forth a healthcare proxy, putting a will together, having last wishes. All those things kind of can be very comforting to some people, but also can be very scary to other people. Yeah. But sometimes just understanding what's available is important.
I told you before we went on the air that I was going to ask you this question. So the Office for the Aging, what is the age group? Who benefits from this?
Well, interesting you should say that. Really, we define it as a senior citizen, and in the process of the last several months, there's a rebranding going on to really understand the term senior versus kind of a better term, older adult. As soon as we're born, we're aging. And as soon as we progress down the line, we're getting older every minute. So we like to use the term older adult.
Okay.
Now, if you're talking about New York Connects, we serve people, and I know this will probably make Mary Ann giggle, but we serve people from birth till they don't need us anymore. Okay?
Womb to tomb.
That's we like to get rid of the end of it. That's why I came up with the friendlier version. Birth till you don't need us anymore. So we deal with not too many, but we are a central place for information. So we do information assistance and referral. That's what New York Connects does. So if a mother calls in and has questions about a baby's progression, we know to send her to early intervention and make that connection for her seamlessly. One of the best things about New York Connects is that someone can call with one problem You know, I'd like to know more about home delivered meals. I'd like Meals on Wheels to come in and do. Well, what's going on? What's changed?
Yeah.
You know, not so much. We're gonna definitely do what you need us to do, and we can do that electronically where we're on the phone with you, which is kind of nice. But we also want to find out, well, what has changed?
Yeah.
Has are you having more difficulty buying food? Are you getting out? Do you have transportation problems?
Do you have money?
Do you have money? And if those are struggles, do you know about X, Y, and Z?
So it's sort of like a one-stop.
Absolutely, absolutely. So that's kind of the joy in New York Connects.
All right, so you service everybody, but
We
what
do.
what is an older adult age-wise? How do we define it? Is there a legal terminology for that?
There's definitely 60 and above becomes your older adult, and
I've graduated. I'm an older adult.
You're in our spot, huh? But one of the best things about New York Connects is we've partnered with specialty hubs, and what we mean by that is we're kind of the one-stop, what we call the no wrong door. So anybody can call us, and we can help them immediately with the services in our area, and if it's in another area, we connect them seamlessly. The idea is to really get the client to only make one call if they need to. So you know the frustration about you call someone, you get a number.
Push this button.
Exactly, exactly. So here, if the caller would like, we can connect them immediately. If they choose to take the information and call later, that's fine too.
So if they call 753-4582, they're going to get a human being?
Well, not on Saturday and Sunday.
But during the
yes,
week.
Monday
So
through
are there
Friday.
hours for that line?
Yeah, 8:30 to 4:30,
Okay.
and then after hours you would get our out-of-office greeting, and then we get back to people within 24 to 48 hours, I
Very
would
good.
say,
Okay.
over the weekend. We take about anywhere from 1,100 to 1,300 calls in a quarter, so quite a few calls, and the calls about 300-400 a month.
Yeah.
And we also encourage people to come and see us. We're right across the road at the HRC building at the county offices on the first floor, 7 North Erie Street. But we also have satellite offices in Dunkirk at the Senior Center there, and also in Jamestown at 610 West 3rd Street. I always liken it to across from Farm Fresh because they've got those great donuts. But we encourage people to walk in and talk to staff. We've got great staff in Jamestown, very busy out there, great staff in Dunkirk, and then we've got our core group here in Mayville. So shout out to the staff. Thank you all for doing such a good work. Many, many programs that are offered through the Office for the Aging. And I was going to flip through here if I can, just to make sure I don't miss them all. Of course, New York Connects, we've talked about a bit, and we've talked about home care. In the home care program, we really encourage people to call New York Connects and talk to them if they have a need. So the core services we offer are assistance with housekeeping, and that could include shopping, assistance with personal care, that means bathing and dressing, and funding for social adult day services, and we partner with Chautauqua Adult Day. And then we offer these things called personal emergency response systems, or PERS. But being from a little bit further down south, it sounds like I'm saying purse when I talk. So PERS, I have to really draw that out. A lot of people know them as a lifeline or a life alert.
I've fallen and I can't get up.
Yes, those are trademarked, so that's like the Coke or Pepsi. We use a company called Critical Signals Technology. We have a private pay program for that, so you don't have to wait for funding to be available for that. So those are the 4 programs under the home care program that we offer. And for a long time, we had a waiting list. When I started in 2008, we doubled the amount of people that we saw in the community offering these services. And by 2010, we had spent all the money. My husband said they hired the right gal. But there's a tremendous need. So we started to build a wait list. And one of the things that has been difficult over the last, that was 2010, here we are 2019, we've had a wait list on and off, sometimes upward to 500 people.
Wow.
And that really speaks to the need in the community.
I don't think people realize we're an aging county
absolutely.
as well. And many of the counties up in Western New York are aging because they stick around.
Yeah.
We don't have any statistics of how many older adults are in Chautauqua County, do we?
It runs, and I didn't bring the actual statistics this
Ballpark.
morning, but I'm going to say we're about 30%. I could be off, so
30% would be about.
if we're about 130 right now, 36, 40,000.
That's a lot of people.
Sounds about right. I might be off, so those of you who are statistic heads, just
Yeah.
give me a break pass on that one.
That's a lot of people.
It's a lot of people, and if we're to reduce the cost of care for people, it's been shown through our research that it's most effectively done and cost effectively done in the community. So New York Connects, years ago when New York Connects started in 2007, the group, the Long-Term Care Council, put together an analysis, a gap analysis, and they created a model called the Chautauqua model. And it creates New York Connects as the center or the hub of information. And then you've got the medical side and the social side.
Good.
And our job is to try to connect the two and recognize that they should function aware of each other. And I think that has really worked over the last decade. There's a greater awareness with physicians in the way they practice and the way they're paid, so that they look at both the medical determinants of health and the social determinants of health. And they realize the significant impact the social has on the medical. It's much greater.
Okay, before I take my phone call, who's called in, caller, just hang on a minute. I just have one follow-up question. When you mentioned the various services, the housekeeping, the personal care, and all these sorts of things, does your office, does your department provide this, or do you co-op with other organizations?
Good question. We don't actually provide them here in our county. We contract with the licensed home care agencies, and we're lucky enough to have 5 of them in our community, which is fantastic. Way across the state, way up north, I forget the county, they've started a coalition across the state of the lack of direct care workers, and they, in that county, only have 1 home care agency to work with. So we're very blessed and very pleased with the services that they're able to offer our seniors. So they supply us with the housekeeping attendant, and they supply us with the personal care attendant to provide those services.
So you know all these agencies, you know the people.
We know the people.
So when folks call you, they can feel assured that these people have been vetted, investigated, that you know that you're
all
that
of the home care agencies are licensed, bonded, certified, trained, and overseen.
Just hear so many horror stories. Well, let's take a call.
Sure.
Okay, good morning, caller.
Well, good morning, Dana.
Hi.
And good morning, Doc.
Good morning,
Good
Linda.
You know, we're having a heat wave out there. It's 8 degrees.
Oh, wow.
Whoa.
Do you have your suntan lotion with you today?
I've got my sunglasses in my purse.
I was really enjoying all the things you two were talking about.
Well,
the
thank you.
beautiful lake Chautauqua, and Lake Erie, Barcelona.
Absolutely.
And when I first came to Chautauqua to apply for a job at the Athenaeum for a summer position as a desk clerk, while I was waiting for my interview, I stood out on the porch and I looked at that lake, and I thought, I have never seen such a beautiful lake anywhere in all of my life.
It is. It's lovely.
Did you get the job?
Yes, I did.
Okay, I needed to know the rest of the story. You left me hanging here.
I came back. I could write a book about working at the Athenaeum. It was one of the most delightful jobs.
All right, Linda, is it?
You should do that. You should write a
Linda,
book.
now here's the controversy. All right, we always fight about institute and institution, but the latest battle I've had is it Athenaeum or Athenaeum?
Athenaeum. That's how we were trained.
Okay.
Way back when you worked at the desk, right?
Yes, and if you want the original phone number, phone number is 357-4444. You know, not like you want help with your insurance.
I was going to say, if you fall and call this number.
It used to be 357-5065.
Oh boy,
Yeah.
You've got quite the memory. That's good. That's good.
So it was such a beautiful lake, and Doug used to always say to me that I married him so I could be near the lake.
Whatever it takes, right?
That's cute.
Oh my gosh. So Linda, what's going on in your part of the world, in your part of the office, over in the Office for the Aging?
Well, before I get into, of course, we're always looking for people, and there's a big demand for home care workers.
Right.
It's a demand occupation, and I would like to tell all my participants and people who are thinking about going back to work, there's a great demand for it, and other jobs. This is a great time to be looking for work. Mm-hmm. But I do want to mention what a great job Dana does with her staff with New York Connects. I have sent so many people to New York Connects when people don't know what to do about home care or health care or whatever. I always send them to New York Connects. It's just a wonderful service.
That's good to know.
Thank you, Linda.
And I also get referrals from New York Connects, quite a few.
You do?
Referrals.
So it kind of comes around to you.
So again, that's that
for
looking
people.
at the person as a whole and
Right.
recognizing, oh, I've got a work issue. refer to Linda.
There you go.
They fit her criteria. So
Yeah, I
that's
do
good.
get a lot of referrals for people who are thinking about going back to work or who want to go to work, people who are interested in computer training, which we provide free for our participants. Now, Dana had mentioned that with the Office for the Aging, the older adult is 60 and over, but we serve people who are 55 and over.
Good point, Linda. Thank you.
Yeah, but that's the only program where it's younger than 60, I believe.
I think you're right.
Except for New York Connects from the beginning until you don't need the services anymore.
There you go. That's our new tagline.
I like yours better than mine.
It's kindler and gentler.
So I've really been enjoying the program this morning. And what do you think about the Super Bowl coming up? Are you getting ready?
No.
I'm making chili today.
We all guessed who was going to be the winners this year, and I think we're all out, just right?
Oh.
I had the Saints going all the way, and they got blown out. We won't go there about the refereeing. Who are you rooting for, Lynn?
Well, the Bills aren't playing, so...
I noticed that, yeah.
I watch the Bills every weekend. I guess it's a toss-up. I don't care. I mean, everybody thinks that Brady's going to carry it, and he is a terrific player.
Can't take that away from him.
Yeah. So we have to give credit where credit's due. We'll see what happens. They didn't win last year. I think it was against the Seahawks, right?
Yep. So,
Yeah,
anything can happen, but right. Well, enjoy the Super Bowl. Have lots of fun.
Oh, I always look forward to it.
Okay.
Great time.
Thanks for calling in, Lynn.
Stay warm.
Bye,
Enjoy
Linda.
the
Thank
beautiful...
you.
Okay, enjoy the beautiful weekend that's coming.
Gonna be
that's
warm.
good. All right.
Gonna be warm.
Bye-bye.
Bye-bye. Well, while Linda was on the line and we
we
were
got
waiting,
another.
we got another question.
Okay.
Okay, the question is, can New York Connects make connections with younger adults in services they may need?
Absolutely.
So, like, what would you do for them?
Well,
Jobs or?
to give an example, well, we can certainly connect them with resources if that's what they're looking for. So if someone needs health insurance, if someone needs
sure.
temporary assistance or protective services or just a myriad of things. It really depends on what they're looking for, but absolutely.
So don't be bashful, if you don't directly provide that service, you probably can refer them to somewhere, right?
Absolutely, yeah, mental health services, whatever the need is, it's good to understand what's available to you. And New York Connects can connect you to those places.
Okay, hang one second. Folks, you're watching Chautauqua Sunrise. I'm Doc Hamels, and my guest today is Dana Corwin, and she's the Director of Aging Health Services for the county. And what else do you want to talk about?
Well,
we've got about 6.5 minutes left.
I know,
It's
I'm
going
looking.
quick here.
Just going to run down some of the services so I don't forget any.
Okay.
Obviously, we've talked a little bit about New York Connects, or a lot more about New York Connects, and what it can do for you. So don't be afraid to call and find out, have a conversation about what's going on in your life. You might be surprised. We can connect people and give them information about veterans' tax exemptions and services. And people are always like, I can get that? That would help me. That would help put a few more dollars in my pocket. So understand that there is a New York Connects resource directory that can be found online, www.newyorkconnects.ny.gov. There's also a larger service called Elder Care Locator that can be done all over the United States. And the purpose of Elder Care Locator.
See, it's not easy.
Yeah, see, it's not easy when you
everybody.
get it. Is if you're looking at something in California and your mom lives in Chautauqua County, New York, you can use Elder Care Locator to find New York Connects in Chautauqua County. So it's a way to connect people all over.
All right, I have a question now.
Okay.
So I know a lot of folks, they're hesitant to move away because their parents still are living in the hometown. But if they wanted to bring them along with them, let's say they're going from Buffalo to Chautauqua County, and they wanted to find some residence or some services for their parents, how do they know that service or home or whatever it is quality? Is there a star system? Is there like a review?
There is all over. You can go to New York State Department of Health and get ratings on all of the assisted livings and nursing homes. We provide information of all the living arrangements in this county and can give that information. This, if I can get it right there, is the senior handbook
Let's
that we
zoom in on that. Can we zoom in on that, Emerald?
There we go.
She'll bring it in tight for us. Okay.
So if you don't have one of those, you can see where I burnt my finger on the wood stove. But if you
I wouldn't have noticed.
if you don't have one of these, we encourage you to pick one up or to call. It's also available on our website, the county website. If you go to the county website, search Chautauqua County Government, and then you go through the departments, the Office for the Aging, it's available electronically. And in here is all of the information that you would need to know about how to be successful in the community and find services. So you've got New York Connects, you've got the Elder Care Locator, there are caregiver support services. We have a grant with the Department of Health and the Western New York Alzheimer's Association in providing caregiver services and respite for people suffering with dementia and Alzheimer's. And we've been helping a tremendous number of people. But there are caregiver support services and groups that meet. We work with Department of Health and Human Services on elder abuse prevention programs. There is a really cool enhanced multidisciplinary team that meets monthly in this community. And they look at reports and complaints and allegations of abuse, financial abuse particularly. So that's important to understand. If you have a situation where you think someone's being exploited, you can call New York Connects and get more information about this enhanced multidisciplinary team that looks at financial exploitation. There's home repairs and access to home programs. There's care transitions programs. We help people transition from the hospital to the home or from the nursing home back home, connecting them with services like home delivered meals or housekeeping supports or other things. There's legal services for senior citizens or older adults. We do a tremendous amount of Medicare health insurance counseling during open enrollment, but also during the year. For those of you turning 65, there's a whole process that you have to go through. And the more you're prepared to do it and the more informed you are, the better off you'll feel. There's a tremendous amount of nutrition services. We have congregate meal sites, home delivered meals. We have a SHINE program, which is new that works with several dietitians in providing nutrition education. We offer dining out sites at different restaurants through the community.
With reduced rates?
Right, you can buy a voucher and then take that to one of our local restaurants and order off a senior menu.
I believe Meters is one of them.
Meters is one of them, and it's very successful. Of course, we have home delivered meals. We talked about those personal emergency response alarms. We have a service called Are You OK? We work with the Sheriff's Department. When you sign up, it generates from the Sheriff's computer a call to your home.
Oh, wow.
Every day. And if you're out and about, this might be a good tool for you to use to have the Sheriff's computer call you at 10 o'clock every day. And you pick it up and it tells you this is the Are You OK call. Push a button if you're okay. Push the button.
Beautiful.
If you're not okay, it generates a kind of cascade effect. Call the next person, find out where they are. It can even initiate a drive-by for wellness.
That is a service I did not know.
There you go.
I learned something
Are
new
You
today.
OK?
That's excellent.
An old program, but still very worthwhile, is the Rural House Numbering Project. We have a tremendous amount of health and wellness programs. Aging Mastery Programs is one of the newest evidence-based programs out there, where you come to a series of short lectures in the community and you learn about how to age well. You know, financially, services, health insurance, all kinds of things. Healthy bones, home safety assessments. I'm looking at my numbers. Tai Chi for arthritis has
I love
been
Tai Chi.
a significant thing. I think some of that's even here. 55 to employment. The HEAP program, furnace repair program, all kinds of things. In-home services, we've talked a little bit about. We do provide a private provider list. We have a list of all of our licensed and certified home care agencies.
All in one booklet.
Social Adult Day.
Can this be mailed to them if they can't?
It can.
So just call that number?
They can call New York Connects. Oh, I love that. 753-4582.
That's right. We pop it up.
And you can get all of this information sent to you, or the directions to get it online. A lot of people like to do it online. But we just encourage you to come and see us. We have a tremendous amount of information, and I can't tell you enough how much our operators are thrilled to help people.
I bet.
You know, they'll come back to my office or Marianne's office after they've gotten off the phone and just say, I just had the best call, and this person didn't realize X, Y, and Z, and I can help them.
Dana Corwin, Director of Aging Health Services. Where are your locations? Because we're running out of time.
Oh, goodness. We are located at 7 North Erie Street and here in Mayville at the HRC building. We are located at 610 West 3rd Street in Jamestown, and we are located at 45 Cliff Star Court inside the Dunkirk Senior Center. So your information is all here. You can call New York Connects, one number to call to get as much information as you need.
It's been a great show. I'm amazed by what you guys are doing. Thanks so much for all that, for all of our older adults. It's a wrap for today. Enjoy the beautiful warmer weather this weekend and week. I'm Doc Hamels. We'll see you here next Saturday morning, 9 a.m. at Access Chautauqua. Have a great weekend. Take care and get the suntan lotion out, right? Bye now.